I'm here with the North Idaho Medical Mission team. We're representing Peace Lutheran Church and Next Generation Ministries.
People always wonder, why are we coming to Uganda? Why don't we help people in the United States? And my first response is anger, because of the ignorance of people in the United States for third world country health care and poverty. You go to these villages that are back in the woods and the jungles, and many of those people have never seen the city. They've never seen a light. They've never seen a car. They don't have access to health care. And in the U.S., if you don't have a job, you're homeless, it doesn't matter, you can go to the emergency room.
We've had an amazing 2 weeks. We've been able to visit 5 villages, treat hundreds of patients, save many lives, and bring several individuals to Christ. We've also been able to do many surgeries, including removing a very large lipoma, removing a fragment of metal from someone's knee that had been there for almost 10 years, as well as many other surgeries, removing many other growths from people's bodies simply because they've never had the opportunity or the means to have this kind of medical care.
We're in a village called Champizi, and we are just here to spread the love of God, be the hands of Jesus, and do what we can for these people.
One thing that strikes me here is how the children are at the bottom of the totem pole, and it makes me cry, sorry, they're so severely neglected that we'd have patients waiting in line, parents waiting in line in triage for themselves to be seen, and they'd be holding a lethargic, sick baby with a fever. And we had to say, can we please see your child? Even if it meant taking them out of line for the clothing or something. We were able to, I think, bless some of these kids. And maybe that's why Maria didn't cry from the pain, is because she didn't realize that she could.
One specific medical case that has just stuck and been close to my heart ever since I first came was a little boy named William, who had a major bone infection in his leg, and I just saw him a couple days ago. And after multiple surgeries and countless nights in the hospital, he is finally recovered and walking again, and really brought tears to my eyes and joy to my heart to be able to see him again.
We had a large team with many working parts, all of which were critical to our success. Our stations included triage and registration, wound care, vitamin distribution and dewormer, crowd control, media, an optometry station, pharmacy, clothes distribution, health education, and of course, the medical care station.
Really, my experience here is indescribable, but the biggest thing that I can't wrap my head around is really the need here seems endless, and every time you help someone it seems that there's more people waiting. I guess it's really fascinating to see what God has done here for the people of Uganda and what He's doing to them and the work that He's doing through those people, especially the volunteers here at NGM that go out with us and see what He's doing for them. They're really His servants, and it really shows for the people working here.
I've been to Uganda one other time, 2 years ago, and I've always wanted to come back because I love the people, I love the country, and I want to serve God by serving those who are needy here in Uganda. One of the greatest joys of serving in Uganda is loving on the little children, and there's nothing quite like helping them, giving them a new pair of shoes, or even a little Smartie candy, and the smiles that you get, the whites of their eyes and their teeth and the smiles, it makes it all worth the trip.
Last night, Paul Hunter said to us, it's about time we realize that God's plans for us are much greater than any plans we have for ourselves. And I just thought that resonated so well with our team, and just the simple fact that all of us just simply said yes to Jesus, yes to coming to Uganda, and we let Him do the rest.